Yeah, I'm very happy to be presenting this to you, and this is a combination of a technique that I developed and a result of a 4-month ethnographic study in a woman's treatment center. So it's a combination of work that I've put together, and I just really want to walk you quickly through why I've done it. We all know IPV is intimate partner violence, and I was on a 5-year longitudinal national study of Canada about the health effects of trauma after women left abusive partners. So we had over 300 women followed for 5 years about the health effects on their intimate partner violence after they left. They had to be out of the relationship for at least 6 months before they entered the study. And so we had many health problems that we had to follow for that many years. So, while we were looking at those health effects, of course, the incidence of substance abuse was really higher. And we know from a variety of studies that trauma is higher, it makes people more susceptible, and I can go over the physiology of that if you want, but that's not my prime purpose this morning. So 2/3 of women that enter into substance abuse centers have mental health problems that include PTSD. And the interesting point for me was that women with intimate partner violence or any trauma who seek treatment for substance abuse have a difficult time benefiting from that. So that really was scattered throughout all the literature, and I thought, why is this? Why is it that women who are going to help other women and women who are coming for help, and the two of them get together, why isn't it working? And a lot of the literature, the therapists had negative feelings about the women that were coming for help. And I thought, how can this be? As a helper myself and a woman, how can this be? So I actually wanted to look at what is happening in that relationship when the woman that comes for help and the helper come together and it doesn't work. What are the ecological factors that are involved? What are the policies in that institution? What are the inhibitions within the woman herself or her surroundings that is making that not work? Which led me to my ethnographic study. So I went for 4 months into an intersubjective ethnographic study using hermeneutic dialogue and participation observation of women and staff. So I had full access to all the placement records, and that I was in staff meetings, I was also in patient meetings, and in the thing. And it was documented that all of the women in that treatment center had a history of trauma, including the staff, okay? And the history of the clients coming in for treatment was documented, but it never had anything to do with the treatment plan. So there was a lot of time spent talking about it, but there really wasn't anything that was planned or doing anything about it at all. And both staff and clients were asked if they knew what PTSD was and if they knew what to do if somebody showed symptoms. Very few of them knew the definition, because in most places, addiction workers are not required to have a knowledge of trauma at all or how to handle it. But when I asked them to give a personal thing, they all gave statements like a feeling of not being real. I can't live within my body because if I get into my body, it's unbearable. I always have to look to see what's safe. I'm constant looking and judging whether I'm safe or not, and so I'm never at rest. I'm always height alert. I live in my head, and then I get startled and I go into my body, and I'm so scared when I go into my body that I develop a panic attack. And because of this, it's very difficult for you to get to me. It's even difficult for me to get to me. and it's like living in a jail that you just can't get out of. So these are staff and patients giving the same account of what PTSD is like. And as I say, a horrendous thing. This is all published in a book. It's called Women, Trauma, Alcohol Dependency, Connections and Disconnections in Alcohol Treatment Centers for Women. And I'm the only, well, no, I actually credited my advisors on it as well, so, but mine's the first author. So years ago, I had developed a technique called rebonding of the body. And rebonding of the body is a multimodality technique, structured program, which consists of 8 sessions of 3 hours each. Normally, it was originally developed for children who came into care because they were sexually abused, and has been altered throughout the years for different genders and different ages with a whole variety of techniques, usually offered on an outpatient basis at this time, though it was originally with the children, it was inpatients. Rebonding of the body is based on the assumption that in order to survive certain traumatic incidents in our life, we have to disassociate or disown certain parts of our personality, and that no real healing can take place until these disassociated parts are revealed and integrated into the person's whole being. And the tech utilizes memories as a pathway to healing, rather than we really get into those memories. The objective is to rebond, and the program is structured and consistent, you'll be happy to know, and it moves from the least vulnerable to the more vulnerable, and it's an individual experience within a group setting. And it's not group therapy, which is normally very confrontive. It is not confrontive at all. It's an individual experience within a nurturing, supportive group. And that uses art, movement. I worked with bioenergetics, a movement therapist and art therapist to do it, creative visualization, and cognitive restructuring. And it needs to be open for abreaction to occur. So people say, well, you're going to trigger the PTSD. Yes, women and people with PTSD are triggered every day. We're going to trigger it in a supportive group with, and giving them techniques that they need to know to handle their own reactions. The element of play must be present in order for this thing to work truly. But the details of the trauma need not be disclosed to others for the integration to happen. Now, the session 1 is, and I have some pictures I'll show you later with this. Session 1 is the introduction to body history, which is really very important for the therapist to get at first, because you obtain the body history, you have a map, and you can judge who's going to have difficulty in which session once you look at that. And then we do the feet, which is the grounding. There's a lot of exercises with women. We do foot massages and paint nails, but they do different stomping areas and different marching techniques for some of the guys. And session 3 is your leg. So once my feet are grounded and I have my legs standing up, and with the legs I do the backbone. You know, I have something there, and then I can start pushing out. And then a lot of it works with the symbolism of what you're bringing into your life and what you're pushing out of your life, and looking at that, what that means and what that says about you. So session 4 is the hands and the arm, and we do a lot of creativity at that point in time. And 5 is the head, and we can look at the various masks that we see, and what can I see, say, and do. And the trunk is the 6th session, where we get the history, particularly strong with the sexual abuse victims, but in many other things, with even nowadays with the breast surgery, they're doing total reconstruction of a woman's body Um, and they're paying a big price for it. Healing Ways, session 7 is an integration session, and session 8 is a self-forgiveness. I tell them if they want to forgive their parents for not knowing any better, or for their husband or that for being a jerk, they can do that. But the emphasis is on forgiving yourself, because particularly with childhood abuse, the people usually blame themselves, and then they move on to the new body and the new way. So this is the actual structure. The structure is very consistent, where there's verbal sharing, play and storytelling, the outline, physical exercise and games involving a particular body part, relaxation, visualization, memory, recall, and then at that point in time, when you get up from the visualization, there's no talking. They go to their outline and do their painting, and then there's sharing and closing. And there's journal and dream writing in between. So when I finished the 4 months, my thing was about trauma-informed care and a longer rehabilitation and introducing rebonding of the body. So one treatment center invited me in to do that, and all the groups were audited for trauma-informed thing, because the groups did create a lot of trauma. They were still using I think that there were, in a group of 10 women, there were at least 5 that had just left abusive relationships, and they were using bats to hit with, and all of the women were triggered within that group. This substance abuse program was only 24 days, so one rebonding session was offered every third day, beginning with day 1. And the programs offered a number of things. So instead of offering programs that were kind of keep busy time that a lot of treatment centers have you structure your time and keep you busy, they gave up yoga, movement, and meditation to allow the 3 hours every third day for this program. So these are some of the drawings that happen. The first 2 drawings here, now I see how this, okay. This first drawing here, these are 2 at the beginning. And you can see they're very non-creative. There's a lot, this one here, this one is the initial body history one. And this is this young girl after treatment. She's available now for therapy. She's not available here at all. She spent most of her time, the picture didn't get her toe, but there's a lot of cut off from her head. She's up here, there's nothing in here. This one is here, is blocked in her neck and her chest, the arms, and here. These are some of the images that they get and talk about. In this person's legs here, a lot of anger and aggression. She was so angry at herself because she had one caregiver and he was in a wheelchair, and she had to go to him to be abused. But he was the only person that was caring for her at the same point in time. So she had carried an awful lot of self-blame. So just a sec, go back here. And here's one leg, she portrays her anger, and the other one, the desolate blue baby crying. In this is the hand section. I was actually quite upset when I saw this drawing here because I thought she was drowning. And she said, no, I'm coming up for air. But if you look at it, both is happening with the 2 shades of blue. And these are some of the masks that we get. If you see sort of all of the different areas that there, this leg, I believe that this is the universal sign for stop. And we had a very difficult session after that group. These are some of the other, I encourage them not to try to do a self-portrait like an artist would do, but to do some math. Now this one over here, here. This was very interesting because when she showed this one, I asked them to take their drawings home and put it in a special place in the room in which they sleep. And because it encourages dreams and they're writing their dreams down. She was terrified to take this drawing home. And I didn't have a place in the place where I was working where I could keep it. We finally negotiated that I would keep it in the trunk of my car. And so when we brought the drawings back, we bring them all back for the integration session. She recognized that this is the face of her abuser. She had not remembered that she had been abused when she was 6 years old. It was her first sexual abuse. She had only remembered a rape when she was the first year at university. But she recognized this as the incident. It was her older cousin, and it was on the day of the funeral of their grandmother, and they were left alone because when parents went to the funeral, and young adolescent, he was trying to console her grief, and they ended up having sexual relationships, and she was damaged by that. I'm sure he was too, but I never met him. In the integration session, they bring their drawings in, and I ask them to place them in a way that makes sense to them. And I give them an opportunity to do that. And then I say, okay, these are your drawings now. Where would you place yourself in these drawings? And you can see she crawled into the center. A lot of the women, one of the women got the table, and she put the chair up on the table, and she stood up on the chair. She said, I've spent a lot of my life up on the ceiling looking down at what I'm doing. So I know this very different than most other people work, and I work with art, I work with physical movement. We have many games that we play. As a matter of fact, I know how to Indian leg wrestle, so, and do other things. The men that I've trained that work with adolescent boys use weightlifting because they feel that it has to mobilize their angry and develops their sense of mastery. So it's gender specific, and it works on the abilities. What I recommend is that 2 therapists in one group, then the group should be no larger than 10 people. I like 6 to 8, but have managed 12, so that if the reaction takes longer, then the rest of the group can move on. But they learn from each other. One of the things that I'm very clear about is what I see in the picture says about me and my experience with other people. And you don't label your things. So if somebody sees something in your drawing that says more about them, and if you want to accept it means for you as well. So I don't take a traditional therapist view of art. I don't take the, this means that and that means that. I don't agree with that at all. Like, let's look at what this is saying to you. So I think that one of the things that we have failed to do, and I mention a lot of in the book, is we're not in a disease model. We're still in a blame model for all the addiction that we have. I mean, maybe some of us have evolved, but as a society, we're still in the area where we blame people and that they're deficient in it, or we lock them up, or we have the testing things. We're not evolved, but we're creating it within our structures and in our community, and that there's nobody that is without some trauma. But we're doing more and more of it every day. We have to look at giving them something. There's so many very simply trained techniques that can help people with their PTSD symptoms and help them manage them and reduce them so that they don't, they're not conditioned to respond that way, and then they get a horrible psychiatric diagnosis that doesn't belong to them, and then they get medicated, and then you're really changing their neuroplasticity. So, any questions? That is my presentation.
Process for doing that individually tailored work. How is this related to sort of the somatic experiencing and a lot of those other things? Because it's not, you talk about rebonding the body. This is more about perception.
No, the thing is that it has the movement has the bioenergetic technique. So the thing is that when I stifle, as maybe some of you thought, that I have to talk about these people, I have to stifle my emotions to keep talking about them. Whenever I do that, my chest tightens. So you can imagine that if a person is beaten with a rope when they're young and they don't want to cry, they can separate from their body. They go up on the ceiling. They go off to other places. So the thing is that those marks are still in my body. Those changes, those locks are still in my body. Those locks are still in your sexual expression. That's why we have so much sexual problems, because our bodies are locked. So there's simple bioenergetic movements where you can open your chest, where you can open your pelvic area, you can open your voice. So you have a voice, and we do a lot of yelling sometimes and doing that to present this and that. And it is manualized, and people are trained to do it. Like when I'm an artist, I paint. I'm not an artist. I guess maybe I am, but I paint a lot. I don't sell a lot, but I paint a lot. And I worked with an art therapist as well when I developed their technique, but I worked with a movement therapist as well. So there are some people who have that ability. So you would work with them. The therapist would work with other people. It just couldn't be somebody that only did verbal therapy to get up